How does genetic testing for CF impact society? Genetic testing for cystic fibrosis plays a big role in shaping how society approaches health, family planning, and ethics. It helps identify people who carry mutations in the CF gene, which is important because cystic fibrosis is an autosomal recessive disorder. This means a child needs to inherit two defective copies of the gene, one from each parent, to develop the disease. Carrier screening allows prospective parents to understand their risk of passing CF to their children. This information can guide decisions like prenatal testing or assisted reproductive options, helping reduce the number of children born with CF. One major benefit is that it empowers people to make informed reproductive choices. Couples who learn they are carriers can consider options such as in vitro fertilization with genetic testing of embryos or prenatal testing during pregnancy. This knowledge supports personal values and circumstances and can help families plan ahead. Widespread carrier screening also helps normalize the idea of being a carrier, reducing stigma linked to ethnicity or ancestry, which historically sometimes led to discrimination or shame. When screening is offered broadly, it promotes fairness and access to genetic information for all populations, not just high-risk groups. However, there are challenges too. Some individuals may experience anxiety or confusion if they learn they are carriers but feel healthy. False positive results or ambiguous findings can cause unnecessary worry. There is also concern about privacy and discrimination. If genetic information is shared or misused, carriers or affected individuals might face social stigma or discrimination in employment or insurance. Protecting confidentiality and ensuring ethical use of genetic data is essential. The costs of widespread testing are another consideration. Screening programs requiring resources, and the expense can be significant. The cost-effectiveness depends on how accurately tests identify carriers and the prevalence of CF mutations in the population. In some cases, the financial investment might be high, but many health experts believe that early identification and prevention can save costs in the long run by reducing the burden of disease. Ethical questions also come into play. Should testing be voluntary or mandatory? How do we ensure informed consent? Who has access to genetic information? And how do we protect individual rights? These are important issues that need careful policy development and oversight. From the perspective of cystic fibrosis itself, genetic testing is a powerful tool to help prevent or manage the disease early. When used responsibly, with proper counseling and confidentiality, it can lead to better health outcomes and more informed family choices. It's often integrated into family planning services, especially for relatives of those with CF or populations with higher carrier rates. This approach balances the benefits of knowledge with the need for ethical and supportive care. Overall, genetic testing for cystic fibrosis influences society by guiding reproductive decisions, shaping public health policies, and raising important ethical questions. It's a tool that, when used thoughtfully, can reduce disease burden while respecting individual rights and promoting fairness. As research continues, ongoing education and regulation are essential to ensure that these benefits are maximized and potential harms minimized. Always consult healthcare professionals for personalized advice and support when considering genetic testing.